Hi, I'm Liz Murphy. I'm a physiotherapist. I work specifically in women's health and I also work in continence, maternity ward. One of the really good exercises to do is your pelvic floor exercises when you're pregnant, and also your lower tummy exercises. This is your pelvic floor, the part underneath. That's why we call them pelvic floor exercises. The pelvic floor is like a sling of muscles or a cylinder of muscles that holds the bottom of your pelvis. It's actually the floor of your pelvis. So it holds all your organs. How to exercise that is to pretend you're sitting on the toilet and you want to try to stop the flow of wee. So you'd be squeezing up from underneath and trying to hold. It's really important that you don't try to hold for too long. You're just holding for what you can. When you're doing your pelvic floor exercises, it's important to try to get an upward and inward movement around your vagina. So you're trying to squeeze around, make it as tight as possible, but you're also trying to get a lift from the inside. So you're aiming for the 10-second contraction, but make sure you're having a rest in between. We've also got two types of fibres in the pelvic floor, like we do with all other muscles. You've got your endurance muscles and you have your fast twitch fibres. So it's like having a long distance runner for your endurance, and it's like having a sprinter for fast contractions. So when you're able to hold for, say, about 6 seconds, you can start doing your fast contractions as well. So that'd be an on-off type of squeeze, and they're important to work both types of muscle fibres, your slow endurance ones and also your fast twitch fibres. And also you've got muscles that are coming around and they sort of act like your inner corset. And they're really important to work on as well during your pregnancy and also after your pregnancy, because they help stabilise you and keep everything together. During your pregnancy you have spikes of different hormones that help relax the ligaments so you can have the bump. So it's important that you can still work on the muscles to keep you together and nice and supported around your middle. So a good exercise to do for that would be drawing your tummy in. So you try to draw if you put your hand just below your belly button and try to draw your tummy away from your hand. It's a really subtle movement. You don't have to suck your breath in. It's just drawing your tummy in, and see if you can still breathe in and out.
Yep.
So counting in and out for 10 breaths is a good set. And if you do 3 sets of those, say 4 or 5 times a day, that'll help with your core stability.
Okay.
Try to add that to your pelvic floor, because the inner corset works with your pelvic floor, so you can't turn one on without the other. They work together. So if you deliberately try to squeeze up and in and lift your pelvic floor, you might feel your tummy working as well. So you can try those. Obviously your pelvic floor's had a hard time during the birth process, so it's important to get that nice and strong again. Some gentle pelvic floor exercises are very good, and you can start these pelvic floor exercises straight after you've had the baby, but if you've had a bad tear, you can start day 3 after you've had the baby. A large portion of women who have had caesarean section still have problems with their pelvic floor, even though they haven't had a normal vaginal delivery. It's important not to overdo that pelvic floor exercise. People say it's good to be able to hold for 10 seconds, but that would be an aid. If you're only able to hold for 2 seconds at a time, that's fine. You build up from there. Trying to squeeze gently to start with, and then picking it up and holding it for as long as you can. Important that you increase your fluid throughout the day. So you're drinking 1.5 to 2 litres a day. If you're not doing this already, don't try to increase it all at once. It's important that you gradually, over a number of weeks, increase your fluid intake to up to 2 litres a day. I'd like to go through some good bladder and bowel habits, because it's very important to know what's normal and what you should expect from your pelvic floor, and just in terms of going to the toilet. A good way to look after your pelvic floor and your bladder is also not to drink too much caffeine, such as colas and coffee, and also bubbly drinks and alcohol in excess is also a stimulant for your bladder. It's normal to go to the toilet 4 to 6 times a day, and 0 to 1 to 2 times overnight as we get older as well. So we should be passing at least about 300 to 350 mils when we're going to the toilet to do a wee. Never go on your first urge. You should always wait till your second or third urge if you can. But using your bowels is different. You should go on your first strong urge to use your bowels. Another good way to look after your pelvic floor is to make sure you're having enough fibre in your diet, and then you're not straining to use your bowels. It's not good to push down. It should be able to come out nice and easily and not take more than about a minute. So correct positioning on the toilet is very important. We need our knees higher than our hips, and you actually bulge your belly out when you need to go and breathe out at the same time, and that's a position to relax your pelvic floor, so it's easy for the fecal matter, the poo, to come out easily without straining. One of the problems with straining on the toilet is that you can develop a weak pelvic floor.